You're good.
All right, my name is Josh Embry. Many of you already know me by now. I'm the Public Health Director here at Grayson County Health Department, and I'm so honored to introduce today Dr. Joseph Lee. Dr. Lee knows many people out in the community. He has been a pediatrician in the community for years and now is retired. However, he continues to serve as the medical director of the local Board of Health. So, Dr. Lee.
Thank you. Thank you, K105, for this opportunity for us to speak to the community about the COVID vaccine. In Grayson County, we've had about 6,590 people immunized, which is about 25% of our total population. However, we've immunized about 66% of those over 65, which is actually a little above the national average. We've had 32% of our over 18-year-olds immunized. We want to increase those numbers, however. To reach herd immunity, we need to reach 70 to 80%. That'll take a much higher acceptance rate, especially in the younger than 65-year-olds. Everyone over 16 is now eligible for the COVID vaccine, so we're encouraging our younger citizens to get the vaccine as soon as possible. This includes even our older high school students. Currently, at the health department, we have a Moderna vaccine and probably will be getting more Johnson & Johnson vaccine, which are eligible for all those people over 18. The Pfizer vaccine may be accessible to our health department over the next few months, and if it is, we certainly would be able to use that for our younger patients. Getting the vaccine not only protects you from COVID, but it protects your parents, grandparents, your children, and our community. The sooner we improve these vaccination rates, the sooner we can get back to the way things were last year early. We have had a number of questions that have come up at the health department and at our vaccine clinics that Josh and I wanted to address. So how we're going to do this is Josh is going to ask these questions that we've gotten from the community, and I will attempt to answer them to the best of my knowledge, and hopefully will be to convince you that this is not something that is a scary thing to do. Thank you.
All right. Well, Dr. Lee, I will go ahead and start with the questions then. Question one is, I'm concerned the vaccines were developed too quickly.
Okay. This has been a totally different situation that we've faced in this country since 1918. We didn't have vaccines then other than smallpox. So it was an emergency situation in our country. And the vaccines were developed faster than other vaccines have ever been developed. However, there were not any shortcuts in the way these vaccines were tested. So the testing for the vaccines, the range of people that they gave the vaccine to and monitored as far as side effects was exactly the same as they did in other vaccine trials. It just was done on a faster pace. And I don't think there's any risk based on the fact that these vaccines were developed quickly. It's a tribute to our country that they were able to do this. So I'm pleased that we had the vaccine as quickly as we did. I hope that people will continue to come in and get them, and we will try to answer these other questions as well.
Okay. Question 2. I never get a flu vaccine. Why should I get the COVID vaccine?
Okay, first, you should get a flu vaccine. And I know there are a number of people that don't and feel like the flu is not that serious. This is a different situation than influenza. I looked at some numbers because this question has come up, and I looked at some numbers over the past 5 years as far as influenza is concerned. And the average number of cases of influenza a year over the last 5 years has been in the 38 million cases a year. Now, we've only had 31 million, maybe 32 by now. I'm not sure the exact number today, cases of COVID. But death-wise, we've had 564,000 deaths. The most deaths that we ever had with influenza since 1918 is 61,000 a year. The average number of deaths per year has been about 35,000 deaths a year. This is 14 and a half times the number of deaths of COVID-19 compared to influenza. It's really important to get your vaccine. If we can prevent you from getting this illness with a much higher incidence of severe morbidity as well as death, we would like to do that.
Okay. Thank you. Question 3. I'm worried about severe side effects. What about the blood clots with the Johnson & Johnson vaccine?
Okay, well, this was a little bit scary when this was reported. I think it shows a couple of good things, however. One is that we were willing to report the adverse effect. 2, they did do a pause in the putting out the vaccine so that they could investigate it further and not keep on and say, well, there's nothing to worry about. The numbers, and that varies from what news program you listen to, but it started out there was like 6 that were reported. I think there's been maybe to 10 or so, but it's a small number out of 6 to 7 million vaccine doses. So it's in the range of 1 in a million as far as that side effect. It has, I think there has been 1 man and the others have been women, mostly younger women from 18 to 50. So it hasn't been in the older population, and it hasn't been, at least very much, in men. They have reintroduced the Johnson & Johnson vaccine. It is available again. That warning is out there, and I think that there will probably be some women that will elect not to get that vaccine and get one of the other choices. Now, as far as severe side effects with Moderna and Pfizer, and there have been in the range of, well, there have been 200 million doses of vaccines given in the country. So, and most of those have been Moderna and Pfizer. So there's only been 6 or 7 million doses of Johnson & Johnson. So we're talking about none of these severe reactions occurring in Pfizer and Moderna. And I think that you should take some comfort in knowing that the side effects that have been reported from Moderna and Pfizer have been, the mild side effects. There have been headaches, low-grade fever, sore arm, fatigue. Those are common side effects likely most people will have that, but as far as the severe side effects, they have not been reported with the Pfizer and Moderna vaccine.
Okay. Question 4 is, what about the effect on fertility in women and in man?
Okay. Um, there has first, I'm not sure how this has come up as a question that people have had, concerned that it might affect their fertility. There have been no reports of it affecting your fertility, so that's very reassuring. I read the CDC's latest reporting on this, and there have not been any reports of it affecting fertility in either women or men. Um, Women have gotten pregnant after getting the vaccine. Women have gotten the vaccine during pregnancy. Um, I don't think that was one of the questions we put in the list, but uh, COVID illness during pregnancy is very severe. And um, although you should talk to your obstetrician before you get a vaccine, most obstetricians are encouraging their pregnant mothers to be vaccinated. There is no effect of the COVID vaccine on breast milk, and breastfeeding does not preclude you from getting a vaccine as well. You certainly don't want to get COVID, and you don't want your baby to get COVID. So getting vaccinated is a much healthier way to do that.
All right. Will we need a vaccine next year?
Uh, I don't have the answer to that. I suspect we will. Um, the We've had the vaccine now close to 6 months. I think the first doses were given in December, and so we're almost to May. It's been 5 months in that range. Uh, there has been no loss in immunity for people that have gotten that first doses of the vaccine. However, they'll be monitoring this very closely, and I feel confident that at the end of that about a year's period of time that the CDC will recommend that you get a booster dose next year. That's not been answered officially yet, so I don't know that as a direct, an absolute answer, but I suspect it.
All right. Thank you, Dr. Lee. What about the variants? Will the current vaccines prevent these as well?
They're still looking at this very closely, and the problem with the variants, and these are different strains of COVID that have cropped up in our country as well as other countries, but initially in Britain, there was South Africa, there was one in Brazil that was particularly virulent. Some of these variants have been much more contagious, and then some of them have, in addition to being more contagious, seem to cause more severe illness. People that have been vaccinated have not gotten the variants. The protection rate has been the same as it was against the initial strain of COVID. So I'm optimistic that the vaccine that we're getting now is still going to protect you from these variant strains. If we get a booster next year, which I suspect will happen, I'm guessing that they're going to include in that booster some of these variant strains, and so that there will be a more certain protection. But right now, with the variant strains out there, and them being more contagious and them being more virulent, your best protection is to get the vaccine, and you will be protected against those. We encourage people to get the vaccines that we have currently available.
All right. I'm worried about mRNA, the mRNA vaccine, changing my genetic makeup. Should I be concerned?
Well, this was one of the initial questions and concerns that was raised. We don't have an mRNA vaccine prior to the COVID vaccine. The technology has been studied for years, and they've looked at developing other vaccines, for example, with Ebola, with this technology. So this is not a new technology and not a new idea, but none of the vaccines that we're getting prior to this have been mRNA vaccines. So when that term came up, I think people were worried, oh my gosh, messenger RNA is going to get into my cells and change my DNA, and somebody's controlling that. mRNA that in the vaccine does not get into your nucleus and does not alter your DNA. It's purely a messenger that gets into the cytoplasm of the cell and makes a protein that looks very much like the spikes on your on the coronavirus virus, and your body then recognizes this protein as possibly coronavirus and makes antibodies. But it doesn't alter your DNA in any way, and there is no danger whatsoever to that.
I think that was one of the most common questions or concerns. So thank you for.
It was initially, I know, especially.
Yes. All right. So here's another very common one. Isn't this another government effort to take control of our lives?
This is a government effort, and it's from the top of the government down to us, in your local health department, in your local hospital, in your local doctors, in your local pharmacies. Not to take control of your life, but to allow you to have control of your life again. We don't have control of our lives right now. We're wearing masks. We're can't visit our friends. We can't shake hands with other people. So the government is trying to control the virus. It's not really trying to control us. This pandemic is different from anything we've seen since 1918. And the number of people that have died from this is extraordinary. You know, we're, I think, right behind heart disease and cancer. COVID is third. And in some months, COVID was first or second. So it's not trying to control our lives. It's trying to control this virus so we can get control of our lives again. So I don't like to get into the politics of this thing, but this vaccine, I feel like, was maybe one of the biggest achievements of the prior administration. I mean, President Trump pushed this to get done, and it got done. And I praise him for that. It wasn't a Republican or a Democratic concept. It was a public health concept.
All right. And so the last question we have is I've already had COVID. Do I still need a vaccine?
Um, yes, we from early on last year, from this started getting big in March of last year of 2020. But from early on, we saw people that had had COVID get a second round of COVID. It was not real unusual for someone to get a second episode of COVID. We do know you get antibodies if you get sick, and you do have antibodies against it. You're certainly protected for a period of time, but we don't know with the illness, we don't know how long that protection lasts. The current recommendation is if you've had COVID, you should get a vaccine. It will boost your immunity and uh, much less likelihood of you getting another episode of COVID. So we strongly encourage people to get a vaccine, even though they've been sick with COVID. And again, I will um, bring up the issue of the former president who did get COVID while he was in office. And then early this year, he got a vaccine after his physician had recommended it. So it's not something that you get the illness and you don't have to worry about it. But we do recommend that people get the vaccine even if they have the illness.
Okay. All right. Well, those are all the questions we have. First of all, I just want to say thank you so much, Dr. Lee. People respect you, and you've been a cornerstone of public health here in the community for years. And we're glad to still have you part of the health department.
I appreciate that. Thank you. I have, in 44 years, I've never seen anything like this, thankfully. So if we can encourage people to get their vaccine, not concerned about the severe side effects, because the Moderna, Pfizer had not any of those. And the Johnson and Johnson side effect, this is extremely rare, and it's only been primarily been in younger women. So I really strongly encourage the community to sign up to get the vaccine. We still have limited numbers, but we're scheduling people now through the health department. I know all of the local pharmacies are giving vaccines, and I think they're scheduling. Some are doing it online, some are doing it by phone. Josh, you know how the pharmacies are scheduling?
I believe the local pharmacy, locally owned, people can call in and make an appointment with those pharmacies. The chain pharmacies, I think that you have to create like an online portal and schedule your vaccine that way. With the health department, you can actually call in as well and schedule your appointment. So there are different ways. If you don't feel comfortable with the online aspect, there are organizations within the county that you can call and get an appointment.
Great.
All right. Well, the last thing I'll say is for additional information about the COVID-19 vaccine in Grayson County, you can visit our website, graysonhealthcenter.org. Select COVID-19 vaccine, and there you can find all the information from where you can go and get your COVID shot. As Dr. Lee said, this is an attempt to get back to some level of normality. So we truly hope if you've been putting off getting your vaccine, that you'll reconsider. Thank you.
Thank you again to K105 for giving us this opportunity to talk to you all. And hopefully you'll decide to go on and get that vaccine. Thanks,
Thank
Josh.
you.